Okay, this is ERD case number 2018-02354, Sherry versus Froedtert South. Today is the fifth day of our hearing. We are, today is the morning session of that hearing. It is approximately 10:33. We unfortunately had another delayed start today. But I think we are ready to go and hopefully finish up the testimony. So I believe we stopped just before Ms. Krakowski began cross-examination of Ms. Sherry. Is that correct?
Yes.
Okay, so Ms. Sherry, since it's been a day, I'm just going to swear you in again. All right?
Sure.
So if you could raise your right hand. Do you solemnly swear or affirm that the testimony that you're about to give is the truth, the whole truth, and nothing but the truth?
I do.
Thank you. All right, then, Ms. Krakowski, you may proceed.
Okay. So I want to just introduce myself as obviously the lawyer for Froedtert South, and want to ask you a few questions about your employment relationship with them. And I'd like to start with just having you give me an overview of your experience with your employment relationship with Froedtert South.
Jack Tag.
Why don't you try to narrow that a bit?
Okay. So how would you characterize your employment relationship with Froedtert South in general?
Object Tag as to time period.
Why don't you just put a time period on that?
Okay, sure. We know that you became employed in 2016. Let me grab my sheet. The date of your hire was January 20th of 2016, and you commenced employment on May 2nd of 2016. Does that sound right to you?
It does.
And can you describe your employment when you began working for Froedtert South?
Still vague as to describing employment.
You mean employment relationship?
Yeah, right, the relationship with the people that you worked with. Maybe that would be narrowing it down.
All of the people, her relationship with all the people she worked with there is still vague.
Yes. Okay, then let me narrow it down even more. Can you tell me who you worked with when you began your employment on May 2nd, 2016?
Dr. Sividasan was my attending physician. Bridget Tierney was a PA that was part of our team. Bessa Ligi was our office specialist. Brandy Ford was our manager. And then I worked with the entire cardiac OR, and then nursing staff in the ICU and cardiac floors, cardiac rehab staff, PT, OT, and then referring physicians, so the cardiology and pulmonary teams.
So it was with the cardiac and pulmonary teams?
I did thoracic surgery as well, correct. And then cardiac care doctors and referring physicians and consultants. So like nephrology and things, people that we would consult onto our service when we needed them.
Okay, would you mind repeating the list of people that you started working with when you started on or about May 2nd of 2016?
So that would be Dr. Sividasan as a part of the cardiac team, cardiac surgery team?
Yes.
So the cardiac surgery team comprised of Dr. Sividasan, myself, Bridget Tierney, who was a physician assistant, Bessa Ligi, who was our office specialist, And then our manager was Brandy Ford. And then we had a cardiac OR team.
Okay. And how
Oh,
would
we
you describe?
We did have Millie Sivadasan as a nurse when I first started, which was Dr. Sivadasan's sister.
Okay, so Dr. Sivadasan's sister worked with you when you first started at FSI?
I think she started shortly after I did, but it was in the beginning of my employment. She was there as a nurse in the clinic.
And her full name?
Millie, M-I-L-I, and then Sivadasan, same last name.
Okay. And how would you describe your relationship with the people that you worked with in 2016 that you just listed?
Dr. Sivadasan, we had an interesting relationship. She had times where she would be yelling at other providers, other employees, but it was kind of intermittent, where she would have outbursts for like days or a week at a time, and then it would get better for a while, then it would happen again. It was kind of a cycle of issues. But that time she didn't really have any issues with patient care. It was just mostly her outbursts were the issues. My relationship with Bridget Tierney was pretty good. We got along fairly well. She was new to cardiac surgery, but she was there before me. So we shared an office. I was training her and first assisting in the OR. And then Bessa Eligi, we got along fantastic. I have a lot of respect for her. She treated our patients really wonderfully. She worked very hard. She really looked out for the team as a whole. And she was always just kind of a pleasant person to be around. Millie Sivadasan was our nurse in clinic. I didn't really have any issues with her.
So let me just back up in the question here. So Dr. Minnie Sivadasan's sister was Millie Sivadasan?
Correct.
And what was her position at Froedtert11?
She was our nurse in the clinic.
Okay, and when you say nurse in the clinic, what does that mean? Can you give me a little more detail about that?
She did all the phone triaging for our clinic. She kind of did chart prep, did vitals, kind of kept like the lab, all the orders going, making sure the prep cases were in, things like that.
All right, and you felt that you got along well with Millie Sivadasan, the sister of Dr. Sivadasan?
Yeah, we didn't have any issues. I wouldn't say we were close friends, but we worked fine together.
Okay. And when you look back at your employment when it started in May of 2016, I'd like to just know if you had any issues with regard to Dr. Sivadasan at that time.
I had some issues with her treating other staff a certain way, as well as some patients. But like I said, it was kind of intermittent, and then she would get better for a while. I know she kind of picked a person that she really wanted to kind of attack at each time, and just kind of was kind of ferocious at that one person for extended period of time, and then she moved on, I guess. So I had issues with that, but I didn't have any clinical concerns with her at that time.
Okay, and then when was the first time that you felt that you had personal issues with Dr. Savatison?
I think she intermittently had issues, probably starting in like the fall of 2017, intermittently with me, but nothing to the extent that 2018 had.
Okay, and what kind of problems did you have in the fall of 2017 with Dr. Savatison?
I think it was mostly her not wanting to do weekends. And then I ended up doing a lot of weekends. Like I said prior, I think one time I worked 34 days in a row. And it was just her and I running the whole cardiac surgery department. We were pretty short staffed. So it was high stress, a lot of hours kind of employment at that point.
So do you think the high stress and overtime contributed to the problems that you had with Dr. Savatison?
I think in 2017 it did. And I think by the end of 2017, she started I was getting more and more concerned about her mental stability. She's starting to be a little more irrational. Her aggressiveness increased. She started acting unusual. And I was concerned. And at that time, I thought it was just her being stressed from working. But unfortunately, that turned out I don't think that was actually accurate. Once January and February started happening, it seemed to get much worse.
Okay, so when you say January or February, what year are we?
Oh, 2018.
Okay. And what would you say occurred that, in your opinion, changed her behavior in January, February of 2018?
I don't know. I honestly was concerned that there was a mental illness going on that was contributing to it.
Can I just ask you, how would you know that?
Her behavior was so abnormal from what I was witnessing that it was not how a normal person would act.
And do you have any firsthand knowledge of any mental health issues that Dr. Savatison had or didn't have?
I know she did admit that she had depression and that she had what is diagnosed as PMDD, which is basically like a severe PMS disorder. But those are the only two things that she told me about.
So you learned of this through talking with Dr. Savatison?
Yes.
And was it a verbal conversation?
Yes.
So we don't have any evidence that she actually was diagnosed with these issues, is that right?
I think in one of the text messages in the exhibits said that she was PMSing, which is the PMD disorder. But no, there's nothing else in writing.
So as far as you know, you can refer back to a text message that says she was PMSing, is that right?
Yeah, and that's somewhere in the discovery text that we went over at some point.
And would you tell us a little bit more about what happened then going into the end of 2017 into 2018 with regard to your relationship with Dr. Savatison?
So starting in like November, December, I started to get more concerned about her behaviors. There were still no clinical issues at that point, really. We were scheduled to go to the STS conference, the Society of Thoracic Surgeons, down in Florida, which is a large international meeting for cardiac surgeons, where we kind of review the most up-to-date literature, new techniques, things like that. So I thought that was going to be a good way for her to get away from work and maybe relax a little bit, which I thought would help with what was going on. When we got there, her behavior got worse. She actually lashed out at another surgeon at dinner that we were at. She started yelling in the middle of the dinner.
Do you know who that surgeon was?
Dr. Dini Rekus. She's a cardiac surgeon out of Waukesha.
Can you repeat that name?
First name is Deemy, D-E-E-M-Y, and the last name is spelled R-E-E-K-I-S, I believe.
R-E-E-A-K?
I would have to look it up.
So R-E-E-A-K, and what was the rest of that?
Rekus.
A-S.
I think so.
Okay.
I'd have to look it up.
And what was the circumstances, or what were the circumstances involving her lashing out at this other surgeon?
We were just having dinner at a nice restaurant, and the conversation went to there was a cardiac surgeon. It was just a news thing. A cardiac surgeon was on vacation in New Zealand, I want to say. Tried to do a U-turn and ended up crashing, and he killed someone. So we were talking about that, and somehow she started getting really riled up about it. Even though none of us knew that surgeon or anything about it, we just read the article about it. And she got really riled up and started yelling at Deemy about it.
Okay. And any other instances of a problem that Dr. Savatison had with others that she worked with?
I think we heard a lot of other issues that she had with other people. Angie left, Bridget Tierney, our PA, left because of Dr. Savatison. She had terrible interactions with ICU nurses, the OR staff, other physicians. I know administration had to step in between one of our cardiologists, Dr. Abo, and Dr. Savatison, because Dr. Savatison called her swear words and wrote her a long letter that was, from what I heard, to be very despairing. We had to remove a nurse that was helping us in clinic temporarily because she started crying because Dr. Savatison yelled at her.
So obviously Dr. Savatison had a problem working with a lot of people within Froedtert South, is that right?
Correct.
And why don't we talk more now about your problems working with her? It sounds like you, unfortunately in particular, ended up having a conflict with Dr. Savatison, potentially the same, if not more, than other people that work for Froedtert South, is that right?
I think it ended up that way after Dr. Savatison learned that I was starting to talk to administration about
Well,
clinical issues.
let's start from the beginning of where your problems it began, and it looks like overall you were respected by Froedtert South staff, and you had a good reputation there, and I don't think that there were problems overall with your employment there. What I'm wondering is, how did it get to be to the point where it was as bad as it was with you and Dr. Savatison? And when did that happen?
I think that when it got really bad was, I know Dr. Mark and Bessa kind of talked a little bit about it, but there was a trauma patient that came in who had a stab wound to the heart. Dr. Sivadosin was down in downtown Chicago at a consulate, so she was not available. Long story short, administration actually called from the ER to ask me to come down and help the trauma surgeon in the ER to help. So I ended up going down to the ER. The trauma surgeon already had the chest open, and we ended up repairing his heart in the ER.
Right. What I'm looking at is trying to figure out how does this relate to your relationship with Dr. Sivadosin?
Right. So once that happened, I got people recognized me. I got an award from the hospital. I got a Shining Star Award. I think she started, I don't know, at the time I thought it was more she was trying to deflect the fact that she wasn't available for this trauma patient in the middle of a day on a weekday. And she started blaming me for that procedure and saying I shouldn't have been helping the trauma surgeon. She started belittling me.
Well, that's really not where my question is going, and I don't mean to cut you off, but what I'm wondering about is what about your relationship? It sounds like at the end of 2017 started to deteriorate in terms of your relationship working with her, not just an incident in particular, but what happened at the end of November and December of 2017 that broke down your relationship?
The witness was describing that, and she should be permitted to provide her answer.
Well, okay, why don't we go back to the date then? The trauma patient that you were called in to help with, when was that?
It was spring of 2018. And we were still in good working terms in 2017, the end of 2017. I just noticed her behavior was starting to change. We were still working well together in 2017.
Okay, so in 2017, you were still working well together.
I just started noticing the changes in her.
All right, and then the trauma patient was in 2018?
Yeah, early in the springtime of 2018.
Okay, and that led to some further issues between you and Dr. Sivadosin with regard to your personality conflict.
Well, I think she just started being more aggressive towards me and trying to undermine me in front of others was, I think, that one of the big things at that point was she was trying to just kind of put her dominance down at that point, I guess.
Okay, so you're saying undermined and put her dominance down. Can you explain that?
Well, I think it's a smaller hospital, so a lot of people heard about that trauma patient in the hospital. And I think Dr. Sivadosin was upset that either I was getting attention, and I think part of it was she's trying to create a distraction from the fact that she was not available for that patient either.
What do you mean by that?
Well, it was a weekday in the mid-morning, and she's on surgical call, so she should have been there. But she was in downtown Chicago at that time.
And how do you know she should have been there?
We had no cardiac surgeon on call at that time.
When you say she should have been there, what do you mean?
There should be a cardiac surgeon on call and for patients at all times, really.
Can you refer to any policy or any particular direction or rule that was violated for that particular incident?
Well, typically in a hospital system, you have to, there's slots that you have to fill for surgical call. Like the cardiac OR team has on-call schedules where you have to be available. And Dr. Sivasan was the cardiac surgeon, so she was supposed to be available.
And how do you know that?
Because she's the only one. And
So,
and if you need a PTO, typically you would have to have a covering provider.
do you know that she was on schedule for that day?
Yes, because they would have told me if someone else was covering, since I was the PA covering that surgeon.
So you're guessing that she was on call that day?
Objection mischaracterizes her testimony.
I'm directing the witness as we would in a cross exam. Are you guessing that she was on call that day?
It would be extraordinarily unusual if there was a locum tenens as a attending cardiac surgeon that I didn't know about, that I would have to report to.
I'm asking you if, first of all, you know that she was on call in that particular day.
Yes,
How do you know that?
because if there is a different attending physician that I would have to report to, the administration should, and Dr. Sivasan would have let me know. I can't practice without having someone to go to. So if she was off, I would have to report to some cardiac surgeon. And if she was off, then I would have to report to someone.
So you don't know if Dr. Sivasan was on call that day or if there was another doctor that was on call that day, is that right?
I said, no. I would have known.
And I'm asking you, and I don't have an answer yet, how do you know that Dr. Sivasan that day?
I'm sorry, you broke up a little bit.
Ask and answer.
Yeah, I believe she's answered this.
Okay. All right, so your testimony is that you believe that she was on call that day. You don't have any documentation to support that, is that right?
I don't have a documentation to support otherwise.
But you don't have documentation to support that she was, is that right?
She's on call unless otherwise stated.
It really is a yes or no answer. Do you have any
Objection,
documentation?
asked and answered.
That she did not answer yes or no, and that is part of a cross-examination.
She can answer this question, Mr. Olson.
I don't have the documentation that says that she's on call for any time other than when she's not.
Okay, so then we are now going into 2018. Anything else that created a problem in 2017 before we move into 2018?
No.
All right. So tell me about what was going on between you and Dr. Sivasan's personality conflict in 2018.
Object to the term personality conflict, and it's also vague.
Okay. Can you rephrase, Ms. Kwiatkowski?
Sure. How can you tell me regarding the beginning of 2018, let's say the first couple of months of 2018, did your relationship with Dr. Sivasan continue to deteriorate?
So after we got back from STS, I was concerned. Dr. Rex pulled me aside and said that she also saw Dr. Sivasan berating a bus driver, and Dr. Rex is concerned or voiced concerns about Dr. Sivasan to me at that time. We got back to work.
I'm sorry, can you repeat that? About what time was that? What time frame?
That was in January of 2018.
And you were coming back from STS?
That was at STS where Dr. Rex pulled me aside.
And can you spell the name, please?
Deemy is Deemy, and
Okay, but I didn't know we were talking about the same. I'm looking at my spelling of the last time you spelled it. Reeak.
Kas. I would have to look that one up.
Okay. All right. And what happened at that time frame?
And then we got back from STS and we continued to work. She continued to act strangely at work and was kind of aggressive and unusual at that point, more so than usual. And then the trauma patient happened, and then things started to escalate after that. She had, I think in February was that patient that was bleeding postoperatively that ended up passing away. And I was very concerned about that patient. And then we had the dissection patient, which was also very, very concerning.
Well, what I'm asking more about is your relationship with Dr. Sivadathan and not so much what she did or didn't do with patients, because that's not an issue in this case.
It certainly is an issue. It's central to the case.
So I'm asking about your relationship with Dr. Sivadathan and what was going on in the beginning of 2018.
Yeah, so those things happened, and then I started getting more concerned. So starting in April, I started discussing it with administration. And then once administration was involved and she was starting to have meetings with administration, things got much, much worse with our relationship. Before it, we were still able to work together. It was tense, but it wasn't it wasn't to the extent where it was later that year or later that spring.
Are you talking about 2018?
Right.
Okay, so it was still fairly good in the beginning of 2018.
It was tense, more so than it has ever been. It's more tense than I've ever worked with another cardiac surgeon. There's, we just kind of, I try to keep it as just going to work and being co-workers and not extending any more than I had to with having lunch together or doing things like that after a case if I didn't have to.
So tell me about the lunches that you had together.
So like typically after we would do an open heart case since I started, after a case, if we had time, we would grab lunch together since we were together anyway. And kind of review
Dr. Sivadathan?
Yeah, Dr. Sivadathan and myself.
What was the time frame during that?
Probably from when I started in 2016 until like early to mid 2018, we would do lunch.
Okay, and where would you go to lunch?
Usually the hospital cafeteria. And then Bridget, when Bridget was there, she would be there as well.
Okay, and when you went to the hospital cafeteria, approximately how many times do you think that happened from 2016 to early to mid 2018?
I saw you broke up a little bit.
Oh, how often would you say you had lunch with her, with Dr. Sivadathan in the hospital cafeteria?
It was probably like, it depended on the week and what was going on, but I would probably guess 2-3 times a week.
And how would you characterize those lunches together?
I think when I first started, they were nice. We got to discuss the case, other patients. We talked about live, just normal small talk at lunch. And then when things started getting tense in 2018, I tried to avoid those, and so did she. I thought it was best if we just kept it business at that point.
Can you expand on that a little bit more?
At that point, she was yelling and belittling me, and I didn't really want to be around that as much as I could. So I just stuck to being in the OR, working in the clinic, doing rounds. I try to avoid any small talk or personal time with her at that point, and I think she was too.
And why do you think she was as well?
There's no like, hey, come to lunch with me, or there was no friendly conversations between us about non-work things.
So the friendly conversations ended somewhere at the beginning of 2018.
Yeah.
And how did that make you feel? Did you miss having lunch with Dr. Savadison?
I miss having a normal relationship with my attending physician.
Would you say that you had a friendship of some kind before the beginning of 2018?
I think we had an understanding of each other.
And what does that mean?
I think I kind of understood when she started kind of lashing out, you just kind of let her be. You just try to be as calm and rational with her as possible. And then when times were good, you just had normal conversation at lunch and talked about daily lives and what was going on.
Okay. So you say being normal. What does that mean in your opinion?
I think not having a tension between two people, not having, I guess tension is probably the best word for that.
So you did feel a tension building between you and Dr. Savadison.
For sure.
And do you think that that had anything to do with anything other than the fact that you had said Dr. Savadison was under more stress? She was having what you claim to be a mental health problem. Is that what you think broke down the relationship between you and Dr. Savadison?
I think that her, I do think that there was some kind of mental instability that was going on. And then with her having anger issues and verbal abuse, I think, and then you add in the trauma patient and her trying to deflect some scrutiny, that was what kind of led to all of this, in my opinion. And that consumed her.
And that was that your primary concern with regard to Dr. Savadison?
That being what?
What she just described, if we could read back the record, I don't know if we can do that.
My notes reflect that she thinks that Dr. Savadison had some sort of mental instability, anger issues, verbal abuse, trauma patient incident, led to tension. That's not, obviously, I didn't record what she said or transcribe exactly what she said, so I don't know if that helps or not.
Would you say that, and thank you, Judge, would you say that led to the breakdown in your relationship with Dr. Savadison?
I think that her anger towards me broke everything down. Yeah. And then I think things got worse when I didn't really approach administration regarding any of her anger and verbal abuse until there was patient issues that were going on as well. That's when I got actually concerned about what was going on.
Okay, so the breakdown in your relationship occurred prior to your bringing any alleged complaints to management, is that right?
It started.
And when would you, in your best recollection, characterize that start of the breakdown in your relationship?
Probably in that January 2018 timeframe.
And did you bring any complaint to management in January of 2018?
I did not.
Okay. So what I'd like to do is I would like to go through, actually, Judge, could I have just 2 minutes to check on my daughter? She's
Sure.
she's got type 1 diabetes and she's not allowed in school right now because of COVID.
Okay.
Just maybe 5
Let's
minutes.
have, yeah, let's meet back at 11:20, okay?
Thank you.
I need to resume the recording. Sorry, there we go.
Okay. So I don't know if you'd like me to call you Ms. Sherry or Charnay. I should have asked you that to begin with. I'm sorry.
Either's fine. Charnay's fine.
Okay. Charnay, I'm wondering, with the breakdown in your relationship that you had with Dr. Savadison, when you originally had that breakdown, did you talk to anyone in management about that in January of 2018?
I did not. I didn't really want to involve administration unless there are actual issues. Like I said, Dr. Sivadasan often picked I call it a victim, someone to kind of aim for a while. And she kind of put in a lot of energy in kind of going after that person for a couple weeks, usually. So I figured I'd just kind of ride out the storm until it ended with her aggression towards me, because I've seen her do it to other people. So I didn't think it was going to be a long-term thing.
Okay, and when you say you wanted to ride out the storm and she's picked other victims, can you give an example that you can recall regarding her picking another victim?
Angie Pfeiffer was bullied for a while. I think that was probably back in like mid 2017, where she got probably a couple weeks of just berating from Dr. Sivadasan. I know Dr. Sivadasan was trying to get her fired as well for some time. She's also had similar episodes with other people throughout the course, with other OR staff, some nursing staff in the ICU as well. And Bridget Tierney for sure had that, and that's what led to her quitting, effective immediately.
When you say trying to get Angie Pfeiffer fired, did that occur because of Dr. Sivadasan, in your opinion?
Well, she was unsuccessful at getting her fired because there's nothing to fire her about, and she doesn't have that power. But ultimately, her behavior led her to Angie leaving, per her testimony back in 2019 or whatever it was.
And when you say she didn't have that power, what does that mean?
Well, she was not her boss, her administrative. She couldn't do that to an OR staff member.
So Dr. Sivadathan could not terminate anyone in the OR staff?
Not to my knowledge, no. She can make their life miserable. And I know she was talking to HR and trying to do everything she could.
So
With respect to Ms. Pfeiffer?
Yes, and other people, but that specific, yes.
so you said she couldn't terminate anyone on the OR staff. Would that include you?
She can tell administration to have me fired, yes.
But could Dr. Sivadathan have fired you?
Not, I think it would have to go through administration as well.
Well, let's just get this clear for the record. Did Dr. Sivadathan have the authority to terminate your employment?
She can, not personally, no,
I mean,
but
it's
she
a
can make
yes
it
or,
happen.
it's really a yes or no answer. I'm just asking, did she have the authority to terminate your employment?
Object, I don't think it's a yes or no answer. And the witness is trying to explain what authority she does have.
I think that the witness does know what Dr. Sivadathan has the authority to terminate her employment.
I mean, it seems to me there should be a clear answer, but we'll let the complainant answer.
I mean,
Object, no foundation.
I'll ask again. Did Dr. Sivadathan have the authority to terminate your employment at Froedtert South?
Object, no foundation.
I think the witness would know who has the authority to terminate her employment.
Do you know if Dr. Sivadathan had the authority to terminate your employment?
I did not.
You
I
did
know
not.
she can refuse to be my attending physician, which would terminate my employment.
Did
Okay.
she refuse to be your attending physician?
Not to my knowledge. Not officially with the state, I mean.
I'm not sure what that means, but you're saying that my understanding is your testimony is that Dr. Sivadathan did not refuse to be your attending physician. Is that correct?
With the state. So
No, I'm
as a physician assistant, I have to have a supervising physician that is documented by the state of Wisconsin.
right. That's not the question. I'm asking you if you know whether Dr. Sivadathan refused to be to have you be her attending physician.
Well, she said I was fired, so I'm going to say in so many words, yes.
Do you know under what policy that would fall under?
No,
And so you don't know if there's a policy regarding whether Dr. Sivadathan could refuse to be your attending physician, is that right?
no,
I'm asking, do you know if there's a policy regarding whether Dr. Sivadathan could refuse to be your attending physician, yes or no?
I said no.
You chose not to work with Dr. Sivadathan during your employment with Froedtert South, isn't that correct?
Object to the form, it's vague as to chose.
Want to rephrase, Ms. Krakowski?
Did you choose not to work with Dr. Sabatison while you were employed with Froedtert South?
Still vague.
What's vague?
The term choose.
What's vague about it?
It has multiple meanings and circumstances attached to it.
Do you understand the question, Ms. Sherry?
Kind of.
Okay, I don't know. I guess you can take one more stab, but I don't find it that vague. So
Thank you, Judge. I am asking if at any point in your employment with Froedtert South that you did not want to work with Dr. Sabatison and refused to work with her.
Yes, in 2018, I was concerned with patient safety and my licensing.
So when in 2018 did you choose not to work with Dr. Sabatison?
It was June 1st, 2018.
And can you tell me the circumstances regarding that particular day?
That whole week, her behavior and aggression, it dramatically increased in May, especially that last week of May going into that first day of June. She started having meetings with OR staff, with just lying about me. She told OR staff and the ICU staff that I was fired. She refused to let me do my job. She was very aggressive and belittling. And
So, but my question is it was during the time of May through June of 2018 that you decided that you couldn't work with Dr. Sabatison, is that right?
that last week got rough. And then by June 1st, I asked to leave because administration wasn't doing anything to make things better. I couldn't take it anymore.
When you say asked to leave and you couldn't take it any longer, what do you mean by that?
I asked to be transferred away from Dr. Sabatison because of the verbal abuse. And then and what was the second part?
You said you couldn't take it any longer?
I mean, she told me I was fired. I was beyond stressed out. I couldn't do my job safely. I was so anxious to come to work. It was just horrible. And then I was scared with patient care.
So let me just back up a little bit because I'm trying to make sure I understand everything. When you say that you couldn't take it any longer and you asked to be transferred, you're talking about you couldn't take it any longer working with Dr. Sabatison.
Correct.
And you were then looking at other options for staying at Froedtert South, is that right?
Well, I was hoping to be transferred somewhere until they were able to figure out what to do with Dr. Sabatison and all the information I just gave them the couple days prior.
When you say couple days prior, what do you mean by that?
So I asked to be transferred June 1st. And then I had my meeting with Dr. Fullen regarding, and Susan Ventura, Nick Galich, and Chris Leslie on May. Well, that happened only 2 days prior.
Okay.
So there was no resolution or any acknowledgement of what was going on. And then I met with Dr. Trimark the day before I was asked to be transferred. And then the day I was transferred was all the things I gave to Dr. Full and Dr. Trimark and administration.
Okay, so then what I was going to get into this in a little while, but I'd like to revisit your statement that you had about the day prior. What does that mean? You said the day prior to talking to Dr. Trimark, you decided to leave your employment.
No, I gave Dr. Trimark information, the clinical information and things I was concerned about the day prior to me leaving, so May 31st.
Okay. So May 31st of 2008 is when you left employment.
2018, yeah.
Did you
I'm sorry.
repeat? I didn't hear the question.
Ms. Krakowski, can you repeat your question?
Sure. The day, I don't remember exactly how I phrased it, but I wish I could have it.
I mean, I think what I have is May 31st, 2018 is the day C left employment. So I think that was the question, was that the day that you left employment? Was May 31st, 2018 the day that you left employment?
I'm going to object. Mischaracterizes her testimony regarding asking not to work with the doctor. It wasn't when she left employment.
She already answered that she did leave employment on May 31st, 2018. It's on the record.
Mischaracterizes her testimony.
Well, it's on the record, so.
I asked to be transferred away from Dr. Sivadasan on June 1st. And then I had meetings with Dr. Trimark on May 31st is what I said.
Right, and you also said that you left your employment on May 31st. We've got that in the record. But what I would like to go through is.
Objection. Mischaracterizes her testimony.
I don't know if it does. I can't go back and check. That's what I have in my notes. If you guys wanted a court reporter, you could have gotten one.
Okay, so.
So we'll have to listen and see what is said. But like I said, that's what I have in my notes.
Okay. So what I'd like to do is go into a couple of exhibits that I've offered. And the first one is ERD 0073.
All right.
Oh, and you have are we stopping at, okay, it's 12:40, right, that we're stopping?
Yes.
Okay.
Okay, here's my Adobes. All right, so I'm sorry, what was the number again? 73?
Yes.
0073?
Yes,
Okay, so that's part of the respondents exhibits?
it is.
Okay. Oh, there we go.
In the meantime, Sharnae, when would you consider your employment have ended with Froedtert South?
When they terminated me with that termination letter on July 27th, 2018.
And were you interested in looking for other positions within Froedtert South when you were employed there?
Yeah, so I was willing to do the hematology oncology position that they offered. I also interviewed with the private teams that work at Froedtert South with general surgery and neurosurgery.
General and neurosurgery?
Correct.
What you said, okay.
Yeah,
And so
they're private.
Were you willing to continue working for Froedtert South?
Yes, at that time, yeah.
And when you say at that time, what do you mean by at that time?
In 2018, I was, yes. Up until I got a termination letter from them, yes.
So can you give me the time period then?
I was willing to go back to work when they offered me a position,
And what was the time period?
2018.
When during 2018?
The entirety of 2018.
And do you remember being offered other positions within Froedtert South for you to work in?
The only two positions that were based by Froedtert South Administration was the primary care physician or position, as well as the hematology oncology position.
Okay, so you had mentioned that hematology and oncology and then general and neurosurgery.
Those are not actual Froedtert South positions. They're private groups that practice at Froedtert South.
Who offered you those positions?
The surgeons.
And who does that mean?
So neurosurgery would be Dr. Ahuja. And then with general surgery, it was Dr. Jindali.
And where does Dr. Huja work?
He has a private office in the medical office building outside of Froedtert South in Pleasant Prairie at St. Catherine's, the previous St. Catherine's.
And he is affiliated with Froedtert South?
He's affiliated, yes.
And would you admit that Froedtert South did attempt to connect you with a position with Dr. Ahuja?
They were willing to put in good words for me, yeah.
What does that mean in your mind?
I think since they have a working relationship, I think they would have gave me a good referral.
And so you would have been able to accept a position with Dr. Ahuja?
Yeah, if I wanted to.
Would you agree that Froedtert South was helping with the potential transfer to Dr. Ahuja's office?
Yeah, I would think they were willing to put in good words for me. So yeah, I would say that
They were willing to help you become employed with Dr. Ahuja?
yeah, they're willing to break my contract so I can work with them. Yeah. And take away that restrictive covenant when they broke my contract so I can work with them.
But they were willing to help you work with Dr. Ahuja?
Yeah, yeah. So I had a restrictive covenant, so I was
Well,
not
I'm
allowed.
just asking really for a yes or no answer. I just
Yeah.
want to know if Froedtert South was willing to help you to work with Dr. Ahuja.
Yes, they were willing to break my contract.
Again, it's a yes or no answer. Were they willing to help you work with Dr. Ahuja?
Yes.
Asked and answered.
It has been.
Okay, so then you said that there was also a willingness to work. Again, we can go through the exhibit in a minute, but you brought up hematology, oncology, and general and neurosurgery. Would Dr. Ahuja be characterized as obviously it's not the doctor that's in oncology, but how would you characterize his private practice?
For Dr. Ahuja with neurosurgery,
Neurosurgery.
he had a big practice. I know he had some issues back in the day that I heard about. I guess I don't know too much about neurosurgery when I worked in cardiac surgery.
All right.
That's what I knew.
Why don't we go through exhibit 0073 that we have up now, and if you could look at an email that was sent from Susan Ventura to you.
Can you see this, Miss Sherry? I just want to make sure everyone can see this. It's large on my screen.
Yeah, I could zoom in.
Okay, I just removed the side, so that should make it a little bit bigger. And just let me know, I'm in control of this exhibit, so just let me know if you need it moved up and down. Ms. Krakowski, same with you. I'm assuming that we need to look a little further down here.
Yep, that's perfect right there.
Okay.
Do you recognize this email from Susan Ventura?
I do.
Okay. And what's the date on the email?
June 18th of 2018.
All right. And do you agree that Susan Ventura was working with you to look at options for you for work within Froedtert South and or other options when you look at this email?
Yes.
And do you agree that Susan was helpful in talking through your options with regard to where you might work in another position within FSI or within other affiliated places?
To a certain extent, yes.
Okay. And one of the options that Susan Ventura sees for you on June 18th, 2018 is an opening for an APP in Dr. Froedtert's family practice. And apparently you turned that position down, is that correct?
I did. I did not feel comfortable with family practice.
Okay. And then the next position was potential of you working in the pulmonary practice. And do you agree that in this email, it states that you could potentially move into a pulmonary practice position?
No, they didn't have an open position at that time and no position was offered.
And you see that Susan was offering to work with you on working in the pulmonary practice, is that correct?
So she knew I was interested in critical care, which is part of pulmonary, and she knew I was interested in it. But no offer was ever given for pulmonary, no. We had discussed previously, I had discussed it with Susan previously that that would be my choice if I could.
In the pulmonary practice?
Yeah, pulmonary and critical care are run by the same physicians.
Tell me about your conversation with Susan about that.
I think there's emails as well as me personally talking to Susan saying that critical care would be probably the most aligned with my skill set for a position at Froedtert South that they would have it, that they were able to offer to me that was actually employed by Froedtert South.
Can I just stop you for a moment, Ms. Sherry? I think you said something about critical care. Are pulmonary and critical care the same in your, is that the same thing?
Yeah, so
Okay,
the pulmonologists run the critical care department.
okay.
So that's where I was wanting to work, and I think that would be probably the most aligned with my skill set, and I actually felt comfortable doing that.
You felt comfortable working in pulmonary practice?
Right, because that was similar to, or it kind of shared some similarities with cardiac surgery.
Sure. And what was your conversation with Susan Ventura about that possibility of you working in pulmonary practice?
She said there was no position open and available.
Was she willing to look into it with you?
I didn't hear anything further from her regarding that.
But she does state in the email that she can explore the potential of you working in pulmonary practice. Is that right?
And we did have a meeting later in July